or may also be a summation of A2 and P2. May also be a summation of A2 and P2. It can occur because of systemic hypertension. Now, why exactly? This why is very important here. Now, let's say, for example, this is what is an heart. Okay, just a second. This is what is heart. This is what is an aorta, and we have an aortic valve here. We are trying to analyze why exactly systemic hypertension is going to produce loud sound. Why exactly systemic hypertension is going to produce loud A2 component, aortic component. So this left ventricle is going to pump the blood through the aorta. Now in case of systemic hypertension, this aorta is going to have more pressure. So left ventricle has to pump the blood forcibly. Left ventricle has to pump the blood forcibly. Now left ventricle is trying to push the blood. So this aortic wall will be kept open for a little longer time. This aortic wall will be kept open because ventricle is trying to push the blood through it. Now when the ventricle stops contracting, starts relaxing, that time, because of the more pressure, blood tries to fall back into the aorta, but this is prevented by aortic wall. And because of this high pressure, aortic wall closes forcibly or closes rapidly. This produces loud A2 component. This produces loud because the back pressure was more. And this produces loud A2 component. A2 component was loud because of more back pressure coming from the systemic hypertension. Now similarly, pulmonary hypertension is going to produce loud P2. Same mechanism, because systemic hypertension is going to produce pressure in the aorta. Pulmonary hypertension is going to put pressure in the pulmonary wall, pulmonary arteries. So all these situations also is going to have the similar mechanism to produce loud A2 in case of aortic aneurysms, in case of syphilitic aortic regurgitations, atherosclerosis. Atherosclerosis will also have more pressure in the aorta, that produces loud A2 component. So this is what we can understand, that these kind of things are possible. Loud P2, pulmonary hypertension, pulmonary artery dilatation. And we can also have a summation of both A2 and P2. Conditions that delay the aortic wall closure or cause early pulmonary wall closure produce a single loud S2. It is a possibility. So we can have loud and softer. In which conditions we can have a delayed A2. Delayed A2 can occur because of left bundle branch block, or I can also say